Good afternoon, everyone. It's 101 Central Time. We are going to begin this session of our support for hospice and home health providers throughout Louisiana and Mississippi. Today, our topic is going to be the at-risk registry. This is our main tool for helping you stay in compliance with the conditions of participation as a hospice or a home health provider in the community. Um, but before we get to that, I just want to say something about about technology. Um, Technology is a funny thing. It can help us and it can also challenge us constantly. Um, I want to first alert you to you can't break the at-risk registry, but your computer may get oh tangled up in technology to the point where it's not responding. The software is not responding to your computer. I always suggest that you restart your computer and then go back into the at-risk registry if that ever happens to you. I also want to say one other thing, and that is that the at-risk registry, as do most secure databases, works best with Google Chrome. A lot of the problems that I see with folks when they're having a trouble with either our website or with the at-risk registry, they're usually using Edge. And to the best of my knowledge of what I've been told is that Edge is not HIPAA compliant. So that may be part of the reason that you're not getting the full use of the at-risk registry, or for that matter, the LMHPCO website, if you are using Edge as opposed to Google Chrome. I'm going to ask people, please keep yourself on mute until you have a question. That way, we don't get any in background noise during today's session. I also want to welcome those of you who are members of HICLA or the Home Care Association of Louisiana or the Mississippi Association for Home Care. If you are a member of either one of those organizations, we are in partnership with you all to provide you with the same services that we provide to our LMHPCO members, namely that we have set up communities, emergency districts and regions in Louisiana, districts in Mississippi, and we've provided for groups inside of our website inside of our platform that you can log into our platform and you will see the latest information about emergency preparedness in your service area. And that's why we ask if you are a member of LMHPCO, if you're a member of HICLA or you're a member of MAC, please just send me an email letting me know what regions for Louisiana regions or Mississippi districts are included in your service area, and we'll be more than happy to include you in those new groups that we've set up through our website. Um, Every year, the University of Colorado predicts what this year's hurricane season will look like, and they've had some pretty good success over the past 20 years that they've been doing this, led by Dr. Philip Kallenbach. This year, he has put out his early
Registry.
predictions. He's put out early predictions. We have somebody on an open mic. Hold on one second. Um, he's put out his predictions for the 2026 hurricane season. And it's slightly below what he was predicting for last year's season. We're getting some background. We're getting here we go. The predictions are a little bit lower this year than they were last year. And he's saying that along the Florida Panhandle towards Brownville, Texas, there's a 20% chance that that coastline will see landfall this year. Usually that's a 27% chance. This year, through his research, he's saying it's a 20% chance. However, that being said, there's still two major hurricanes, six hurricanes, and two major hurricanes that he is predicting, and no one really knows where they're going. It's just that our chances of seeing those hurricanes or that type of activity in the coming season, he's saying, is a 20% chance. So it only takes one hurricane to mess up all of these predictions, but it gives us some level of comfort to know that our chances along the Louisiana Mississippi Gulf Coast or below normal this coming year. These predictions will be updated as we go through the hurricane season. So it could rise, it could fall, it could stay the same as we go through the next 6 months of this hurricane season. So I was telling you, we are now setting up all of these groups for our members and also HICLA and MAC members as well. And it simply gives you a platform that you can log in to get the latest information with regards to emergency preparedness for your district in Mississippi or your regions in Louisiana, depending upon what is involved in your service, which areas are involved in your service area. So if you would send me an email, that's jboudreau@lmhpco.org, and just let me know the name of your agency and which districts or regions are included in your service area, I will turn those groups on for you. So we're going to talk about the at-risk registry today. And in Louisiana, the at-risk registry is mandated by LDH that all hospices and home health in Louisiana license that they are to use the at-risk registry. And in Mississippi, the Mississippi State Department of Health highly recommends and encourages Mississippi providers to use it, but it's not mandated as it is in Louisiana. This registry fulfills your agency's emergency prep COP responsibility to inform your local emergency managers of those patients that would need assistance in the event of an emergency or an evacuation. That's what the at-risk registry is all about. It's about alerting the local emergency managers in the parish or county that your patients are residing in, that if there is an evacuation, a mandatory evacuation order called for their neighborhood, these emergency managers know that these particular folks will need the assistance of their office in order to comply with that evacuation order, that there's a reason that they can't do it themselves. So this does fulfill that obligation for your agency. It keeps the emergency managers aware of the special needs of your patients. This registry is not for nursing home patients. It's also not for licensed assisted living facilities. If one of your patients is either in a nursing home or a licensed living assisted living facility, you do not put them into this registry. Licensed facilities have to have their own emergency plan, and those residents that you're caring for in those facilities will follow their emergency plan if there's an evacuation order. However, I do want to say that in both Louisiana and Mississippi, there are such things as unlicensed living facilities, unlicensed living, assisted living facilities. And in those cases, you would put those patients into this registry. It's up to you to find out from the facility whether they're licensed or non-licensed, in order to make that determination as to whether or not your patient should be put into this registry. You are not to put all of your patients into this registry. Who is this registry designed for? It's designed for patients that fall into one of four categories. Either the patient is living alone without a caregiver and would be unable to evacuate themselves, or they have a caregiver, but the caregiver that they have is either mentally or physically incapable of carrying through on an evacuation order, or three, they don't have the financial means to evacuate. It's been researched that a 3 day evacuation will cost an average family of two about $1,000 right now for that evacuation when you're taking into account transportation, gas, food, lodging, away from home over a 3 day period of time. It's going to run them about $1,000. If your social workers or determining that that patient simply could not afford that that extra $1,000, you can put them into this registry. And then the fourth category is was put in there by the emergency managers themselves, those patients simply refusing to evacuate. Uh, just they're plain stubborn. No, they're not. They're saying they're not going to evacuate, even though the hurricane or the weather is coming that way, and they're being advised to evacuate. Either way, you need to mark the reason that you're putting them into the registry, and we'll get to that in a little bit. So those are the four criteria. One of those four criteria has to be met in order for you to put patients into this registry. This is not a registry for you to just simply load your entire census into. That's not what this is about. Your obligation as a hospice or a home health provider is to help the individual work, discover, create a workable evacuation plan. It's when that plan is not practical or it's not real that you put patients into this registry. When you cannot, you're supposed to be doing everything you can to connect them with family members, neighbors, church or civics groups that will take care of these patients in the event of an emergency, in the event of an evacuation order. Um, your job is to help them develop their plan and to make sure their plan works. It's when you know that that plan is not going to work for that patient because of one of these four reasons that you put them into the registry. Now, to put them into the registry, you have to get their consent. They have to consent to being you putting their healthcare information into this registry that goes out to every emergency manager in Louisiana and Mississippi. There's a consent form that you can find at on our website. There's a consent form for Louisiana as well as for Mississippi. It's done in a Word document, so it allows you to open it up and to just take it and copy it and put it into whatever form you are currently using, with your logo and contact information. There's also on the website an evaluation form template for Louisiana and Mississippi. These templates allow you to gather, it's a one-page document. It allows you to gather all of the information about that patient, to record all of the information that you're going to need in order to complete the at-risk registry. And making sure that all of the information about that patient is being put into the registry. Are there any questions about anything that I've said thus far? Just looking to see if there are any questions in the chat box. You can unmute yourself if you have a question at any time. Feel free to ask, interrupt me and ask your questions at any time. We'll go on. We've added a new feature to the at-risk registry. It's a new button. It's a new column in the at-risk registry that is going to alert emergency managers when your patients are actively dying. Every parish, every county, every district, every region is treating patient. They have their own way of handling the information that we're providing to them. A lot of them want to know one major question is, are they actively dying? If they're actively dying, that is going to limit their choices in terms of where they may be transporting your patients. They're going to try and keep a lot of emergency managers are trying to keep those patients who are actively dying closer to a safe place within their parish or their region. So hospitals, they may transfer them into a hospital rather than sending them to a special needs shelter in another part of the state. So that's why we're going to be asking this new question, or we have this new column in the at-risk registry that you will see, and it says, is the patient actively dying? Either they're currently non-responsive, or it appears that they're transitioning towards that non-responsive phase of actively dying, or in your best clinical judgment, do you expect your patient to start transitioning or becoming non-responsive within the next 5 to 7 days? Remember, we are doing a weekly update, and so if you're anticipating that your patient's going to go active in the coming 5 to 7 days, you want to mark those patients as actively dying in order to alert the emergency manager that special care is needed here for these particular patients this particular week. Any questions about this new feature? We'll get to it in just a little while. Here's a diagram of what it actually looks like. It's next to the column where it says needs assistance, yes, and then it says active dying. There's a yes or a no. It's a drop down box and you pick either yes or no. If your patient is not dying, there's no need to even touch that box. We only need yeses in this column in order for that to be triggered. Now, very, very important. We have lots of patients throughout Louisiana and Mississippi that are on hospice. In fact, most of the patients inside of the at-risk registry are on hospice, and we want to transmit current and accurate information to the emergency managers about these patients. We therefore require every user to go in there on a weekly basis and do the update. You're updating that patient to say, yes, this patient is still alive. Yes, this patient is still on service in home health. And yes, this patient still would need assistance over the coming 7 days if there was an evacuation order called for their neighborhood. 25% of all the hospice patients in Louisiana are only in hospice for about 7 days. A little over half of them are only in hospice for about 30 days. And that's why this becomes so crucial in terms of that weekly update. And the weekly update is simple. I will demonstrate it when we get into the registry, but it's very, very simple. It's just that you have to make sure that it's done on at least every 7 days. The last thing why this update? The last thing emergency managers need to worry about in an actual emergency is to have to sort through names and addresses of either deceased patients or patients that are no longer on service within their jurisdiction. And that's why we rely upon your clinical judgment and your clinical skills to make sure that the list we are sending emergency managers every Friday morning at 7 a.m. is as accurate and as correct as is possible. So we're actually going to go and try work inside of the at-risk registry right now. Hold up and let me just change screens a bit. Uh, Make sure that it's up there. One. Okay, and through this. So when you sign into the at-risk registry, this is the landing page that you will start at. And you're going to sign in using your special, unique office username that you've all been assigned. And if you don't know what your username is, you should call me so that we can work that out. And then your unique password that you've also been given. And if you don't know what your password is, please again call me so that we can um, tell you what that is. Normally, it is the telephone number for your agency, minus all dots, dashes, parenthesis, or space. So it's just one continuous number. You put your username and your password into the face page, and you hit submit, and it's going to take you to the watch point at-risk registry. This is simply, it's just think in terms of a big Excel spreadsheet is what you're creating. And it's very, very simple to use. Excuse me. It's simple to use. You just simply come in here and whenever you want to add a patient, you would simply add new record. And then you will see it puts a new line in in your spreadsheet, and then you would simply double click that line in order to activate the line, and then you would start with the name of your agency is in the first row. The second one is your patient needs assistance. Are they actively dying or not? You don't have to move anything there unless it's a yes, but you would put in their last name. You would put in their first name, their gender, their address, the city. It's drop down the state. There's a drop down box for a lot of these questions to help you through there. Once you pick the state, I'm going to put in a telephone number. Once you pick the state, then it's going to give you if you pick Louisiana, it's going to give you all 64 parishes. If you pick Mississippi, it's going to give you all 84 counties. And it's really important that you um, pick the parish or the county that this patient is living in, because that's how the algorithm reads all of the reports to make sure that all of the patients are being sent to the correct emergency manager. I will tell you every week we have 3 or 4 patients who are not assigned a parish or a county, and I have to go in there and literally change them. It causes us a delay in getting that information out to emergency managers. A very important aspect of the at-risk registry is that you want to tell the emergency manager how much this patient weighs. The weight is very important in terms of transportation because it alerts the emergency manager as to how many people they need to send to transport this patient. Sometimes it just requires one person in terms of if that person is ambulatory, or two people if they're on a stretcher. Sometimes we have seen patients at 600 and 650 pounds, which would require additional personnel to move that patient on a stretcher. So you want to put in that patient's weight, um, and then you would go to the address. Let's see. Um, all of these columns you can expand in order to read. If you're having trouble reading the labels, just go to the top and move them across. Uh, Royal and Kellerick, Royal and Kellerick. It's a, you want to tell them if whether it's a house, a mobile home, or an apartment, or other. If it's in a complex, give them the complex name or the apartment number. It's automatically going to assign that patient to the region, depending upon where your office is located. You want to put in a date of birth. And for the date of birth, you put in the patient's year, followed by the month, followed by the day. It's a very strange way, but that's the system that was set up. You would put in the patient's email if they have that. If they have an email, because some emergency managers will communicate throughout the season with those residents that they have email addresses with. The zip code. You want to put in the patient's diagnosis, and the primary caregiver for that patient, their name, along with the primary caregiver's phone number. Um, Primary caregiver, this is primary caregiver's telephone number or their mobile number, the next of kin, and the next of kin's phone number if it's different from the primary caregiver. You want to put in the patient's physician and the physician's phone number, the physician's fax number, the DME supplier for your patient. What's the DME supplier's name, their telephone number, their pharmacy, the pharmacy name, the pharmacy phone number. It's automatically going to timestamp what you're doing in here so that we have a record of when these things change and how they are amended. But then you need to tell them what type of transportation this patient would need. If they are mobile and they simply need transportation out of the neighborhood, emergency managers could send a car, they could send a van, they could send a truck, they could send a bicycle. It doesn't matter. The patient just needs a way out, is what you're telling with any. Paratransit means that the patient is in a wheelchair, and so they need a wheelchair lift. Ambulance means that they're on a stretcher on their back, and they would need an ambulance. State law requires that if an emergency manager does something with a patient, they have pets, they have to also provide for the pets. So they need to know whether or not the patient has pets in the home that will have to be accounted for. And then the next drop down is, why are you putting it in the registry? You have to pick one of those four categories that we discussed earlier. Is it that they're living alone without a caregiver? Or is it that they have a caregiver, but the caregiver is incapable of carrying through on an evacuation order? Is it because of a financial reason? Some emergency managers actually have travel vouchers and overnight stays in hotels or arrangement with hotels that they can actually give to some patients. In some patients, in some parishes, some jurisdictions, they have that, in others they don't. But they need to know what the reason is, and are they refusing to evacuate? And I want to say one other thing. Even if they're refusing, the patient has to give their consent. So they have to sign that consent form in order for you to put them into this registry. The next section is just little checkoffs. Are they on oxygen, O2 dependent? Are they on a ventilator? Do they have infusion therapy or a feeding tube? And you want to make sure to mark what is their mobility like. Are they ambulatory, or they just need assistance, or are they bed bound? Now, I need to say we've seen some examples in the past of where there's conflicting information. They will say they're ambulatory but bedbound. You want to be consistent in your description of these patients. Are they in a wheelchair, a walker? If there are any extra care supplies that are needed, you can post that there. And then once you get to the end, you hit post. And post is the same as save. You would hit post, and your information is now in this registry, and it's going to stay in this registry for 7 days at a time. At the end of 7 days, the second column, you see where it says needs assistance? At the end of 7 days, it just jumps to no. The algorithm just works that way. It just says no, it goes to no. If your patient is in the no position, that means that that patient's information is still in the registry. However, it's not going to be included in the report that goes out on Friday mornings to every emergency manager across Louisiana and Mississippi. That patient's name will be withheld. That means that that patient has not been updated. We don't know the status of that patient. That becomes problematic in an actual emergency, because emergency managers are then looking at that timestamp to see when the last time this patient was updated, to determine whether or not they need to spend the resources to actually follow through to find out if that patient is still alive, still on service with a home health, or what the issue is and why that patient wasn't updated in the right way. Okay. Now, that's all it is to put them in and do the update. In order to do the update, it's very, very simple. You would sign in just like we did a little bit ago, and then you would hit the bulk edit button, and you're going to see the page is going to reconfigure itself. And you see these two little boxes here. You would simply put a check mark in each box that the patient needs to stay on service, and then you would hit submit. Once you do that, these patients are now good for the next 7 days. From the moment you hit submit, the algorithm starts counting down to 7 days, and at the end of 7 days, at midnight, it simply goes over to no. So as long as they're in the yes position, they will be included in all of the reports that go out to the emergency manager. Um, it's very, very simple. One thing I do want to caution, you see, is a lot of people think that you can click on this little box up here and everything will light up here, but it doesn't. It doesn't work that way. This has been deactivated so that we require you to make a deliberate check mark on each patient in the system before you hit submit. Are there any questions about the process, about this process? Okay, I do want to say one other thing about patients. Once a patient is no longer on service, or a patient is now deceased, we want you to take that patient out of the system. If they are no longer on service with you with home health, or they are no longer on service with you with hospice, we ask that you remove them from the at-risk registry. And it's very simple to do. You can either go to the end here and simply hit that delete button, and it will take them out. Or you can actually go to the patient view, which gives you a shorter distance to get to the delete button. It just gives you this basic information. We need you to keep it in the patient expanded view in order to get all of the information that was on that evaluation form that you were taking down about the patient. All of those features or have a column in the at-risk registry to be filled in. Any questions? Uh, uh, Two other features I should mention is once you have your patients in there, there's this little blue button on the right hand corner, and if you press that button, it will produce for you a spreadsheet with all of the information about your patients. It will download a spreadsheet for you to keep on record about your patients. And it looks just like this. And it gives you the ability to keep a record of who you have in the at-risk registry. That's a very nice feature so that you can, keep that and prove that, you had the information in your system, in the system. It also gives you the ability to do a PDF as well. If you have any issues or problems, you can always go up here and there's a support button. You press the support button and it is going to take you to, this is a demo site, but this will take you to a little form and you simply put in there that you're having problems. You write what the problem is and then you hit submit, and that immediately comes to me and to the software engineers for the registry so that we can get on it and fix it as quickly as possible. Other than that, you would simply log out by pressing the log out button. Okay. So I want to talk a little bit about something that happened in the New Orleans region a couple of weeks back related to the at-risk registry. And what we'll do is do this. And let me just set up that screen. Okay. Okay. And we do this. Go to um 2 weeks ago, Region 1, which is Orleans, Jefferson, St. Bernard, and Plaquemines Parish, they conducted a tabletop exercise called Operation Safe Transport, where they wanted to see exactly how the at-risk registry was going to operate in a tabletop exercise. They brought in about 75 people who would be involved in safe transportation of your patients together for a 2-day exercise at West Jefferson Hospital. Some of the folks that were involved in this, there were federal folks out of Washington, Transcom, the National Disaster Medical System was there. They had folks from the Department of Health, the Louisiana Hospital Association, GOSEF, Louisiana Response Network, the Office of the Surgeon General. There were regional people there, Region 1 Healthcare Coalition folks, as well as the EMS, emergency medical services agencies that operate inside of Region 1. And then they also had parish officials, parish emergency managers, Jefferson Parish, Orleans. They had all of the hospital emergency managers were there, as well as West Jefferson Medical Center, which hosted the event these 2 days. It was an amazing exercise to witness. And I was fortunate to be invited to participate in this and watch what they're actually doing with the information that you are providing them every week. It was a 2-day hybrid tabletop functional exercise to test the at-risk registry and their other parish list. Uh, in addition to the patients that you're taking care of under home health and hospice, every parish also has a secondary list of folks who say, I need assistance if there's going to be an evacuation order, and I'm not on hospice, I'm not on home health. In Orleans Parish, there's typically about 100 patients, 100 additional people. In Jefferson Parish, it's an additional 75 or so. And every parish has these lists. So not only are we dealing with the list that we are providing to the emergency managers in every region, in every district, but they also have a separate list that they also have to incorporate into their planning. With regards to Region 1, which is this blue space right here, you also have to remember that we're next to Region 3, which is the Houma Thibodeau Bayou region, as well as towards the north of us, the North Shore. So we were just looking at Region 1 patients that you are that you are identifying. And this was for the week of April 10th. You can see what the numbers in the region there were about 235 patients on that particular day that they used that particular report. And I just wanted to compare this. In the peak of hurricane season last year, we had about 270 patients that were on the list. And that's why um, I wanted to see what it's like now in the non-hurricane season as opposed to the peak of hurricane season when we get into August and September. Now, we break this down by these in parishes in terms of those numbers of those patients. We learned some things. The exercise taught us a lot of gaps that are there. One is that in Louisiana, we consider a bariatric patient at 350 and above pounds. The feds, on the other hand, consider a bariatric patient to be 250 pounds and above. Why is that important? Well, in the second day of our exercise, the hospitals were being evacuated, and those patients that we had been transferring into the hospitals as well as into the shelters had to be airlifted. And on an airplane, weight is everything. On these transport planes, weight is everything. And so we have to have an accurate weight of each person that is being put onto onto an airplane. So weight is a vital metric that we need. In terms of this report, we found that 59 of the 235 patients had to be, we needed ambulances for them. 20 required paratransit or a wheelchair lift. And then the other 156 were mobile enough to where we could move them by simply sending a van or a car to pick up those patients to get them to another location. So that's why that distinction is so important, because when you break it down, we were able to get our ambulance need down to about 59 patients in this particular region. We're only talking about Region 1 here. We're not talking about a statewide. And remember, when we have an incident or an evacuation order, depending upon which way the storm is approaching Region 1, it could be impacting Region 3 and Region 9 at the same time. So that's why all of these things are part of this giant puzzle that emergency managers are constantly trying to work through in every situation. So in this particular exercise, the first day was moving all of the patients from their homes to either a hospital, a medical needs shelter, or a general population shelter, or some other facility that was being established in the region. The second day of the operation was then moving folks that were in hospitals from the hospital to another location, and that was flying them out to other states, actually. So, if you remember back in past experiences when we've had federal support during major disasters, oftentimes we have moved patients to other locations outside of the state. In Jefferson and Orleans Parish, they were given both lists. They were given our list, which was the 238 patients that we had identified, but then they were also adding in the additional list that they had been collecting from their departments of health of those patients who aren't on service with hospice or home health, and including them in this, and working all of those patients through this system to see how many could be processed and moved safely in a 1 day, 2 day evacuation. So out of the 238 plus 175 with about 400 patients that would need to be moved out of Region 1, we were able to do about 75 patients. So about a, a quarter of the number of patients that actually had to be moved. And part of the reason that we could only get to 75 is that we found a lot of delays in the system. One of the biggest delays in the system occurred in terms of their communication with the providers in Region 1. They had to get more information about the patients because the patient information that was being collected, they were missing big chunks of the data about these patients. We'll be talking about that a little bit more. So in when you're working with the at-risk registry, please complete all of the fields we want you to complete. And we want you to complete the weekly update. We ask that you do that on Thursday before the close of business. We send out a reminder to everybody to do that update before the close of business on Thursday, because those reports automatically go out every Friday morning at 7 a.m. And as long as you've done the update on Thursday, then the information on Friday morning is going to be accurate and correct. What the lessons that we learned with regards to for the provider community, users, providers, hospice and home health agencies were not completing all of the fields, especially with regards to weight, date of birth, and zip codes. Those three items are crucial to evacuation. We talked about the weight, and the reason for the weight is that it determines how many people the emergency manager has to get out there to actually move that patient. But also, if that patient has to be put on an airplane to be sent out of here, the weight becomes crucial. And so when they would get the patient's names, they would see there's no weight for them, so we would have to call that agency to get the weight. Or there was a date of birth missing, or the patient's zip code. And the reason the patient's date of birth and zip code are important is because those two items become a unique identifier for the patient. Just like when you go to the pharmacy and you say, I'm here to pick up my prescription, the first question they're going to ask you is your date of birth, and they're going to be able to find you by your date of birth. Well, the date of birth and the zip code are become unique identifiers for patient tracking. So that's why those two items are very, very important. The second thing that was observed, or by this entire exercise had evaluators that were working the exercise, and the other thing that they identified as a real problem is that when they would make a call to the hospice or the home health agency, the person who answered the phone, your receptionist, when they identified themselves as needing to speak to someone about this was emergency management, that there was a critical information that they needed about their patients, the receptionist didn't know how to route the call. Your receptionist, when they say emergency preparedness, there should be a point person in your agency that the receptionist knows. I send this call to this person. And more often than not, the observers noted that the hospice or the home health agency receptionist didn't know how to route the call. LDH was on the call. They actually clocked all of this. They were on a call waiting for someone to pick up to answer questions about the patients for 18 minutes. They were placed on hold. That's part of the official record now, that agency put the LDH on hold for 18 minutes. We have to do better. This was one of the big holdups in terms of only being able to process 75 of the 400 patients that needed to be processed in this exercise. If you remember, before this exercise took place, I contacted every hospice and home health in Region 1 and got not only the telephone number for the agency, but I also got the DON's a cell number so that there would be an alternative way of connecting with the DON if everything else was failing. Well, they started calling the DON's cell number, and because the DONs didn't recognize that number, they didn't answer their phones. They may have been in team, they may have been on a patient visit, but they saw a foreign telephone number, and they didn't answer their phone, even though I had alerted them the day before that if you get a phone call from LDH, to please answer the phone, because it's not identified as an LDH number. People were not picking up their cell numbers, so that's a gap. That was another way in which it was delayed. Patients' information in the registry was inconsistent. Some patients were listed as bedbound, but also ambulatory. It can be both. You have to be consistent in your description of the patient's condition. And finally, there was a recommendation that we add a new field to the at-risk registry right after whether or not they're actively dying, in terms of what is the hospital preference for that patient. If the patient is actively dying, which hospital would the patient, the family, prefer to go to? And so that's something that we're asking the software engineers to include before the beginning of hurricane season. And hopefully you will start seeing that as a new line in the we've already included it in the revised evaluation forms that we talked about at the beginning of this particular session. So there is a place there. We're just waiting for the at-risk registry, the online platform, to include hospital preference next to whether or not they're actively dying. Any questions on anything? I know we've been going over a lot of information. Are there any questions that you have about anything I've said?
I have a question.
Yes, ma'am.
My login, I cannot recall what it is because I haven't used it in a while.
You
And
you
when I
can't.
put in that password, how long does it take to get an email to reset your password? Because I haven't received one since we've been on this call.
You have to call me to get that password reset.
Okay.
Okay. And it will take less than 30 seconds, but you have to let me know that you need to reset that password.
And how do I call you?
You 504-491-6133. Again, that's 504-491-6133. Or you can just drop me a line, an email at jboudreau@lmhpco.org. That's
Okay.
jboudreau, lmhpco.org. Thank you for that question. Anybody else? Okay, so as I said, we send out a reminder to everyone on Thursday morning asking you to do the update for your patients before the close of business on Thursday so that everything will be accurate and correct on Friday mornings. You're also invited. We do a regular week this session that we're doing today is part of our weekly series. Every Wednesday at 1 o'clock, we will have a Zoom call where we can discuss emergency preparedness. We talk about the at-risk registry. We talk about who's not updating. We have walls of shame for those agencies that did not do the update the previous week. When we have guests or special topics, it will all be addressed on Wednesdays at 1 o'clock. I will tell you that during hurricane season, I've already contacted emergency managers across Louisiana and Mississippi, asking them to give me dates when they would like to talk about the special protocols for their particular region, things that they need providers in their region to know, or in their parish to know, that may be different from another region or another district or another parish or another county. Every emergency manager does things a little bit differently. They handle the information. We're sending them differently, and you need to be aware of what those special protocols are for your patients. Will a recording of this webinar be available for sharing? Yes, there will be. This is being recorded, and we will post it on our website. So you can just click on our YouTube channel and get this information. So the at-risk registry for today, for instance, we know that there are 264 hospice agencies have access to the registry right now, and they have about 1,500 patients in the registry, hospice patients. And as of this morning, 908 needed assistance, but there are another 592 hospice patients in the registry who have not yet been updated as of this morning. They weren't updated last Friday, and those same patients have not been updated since then. So as of this morning, they were not updated. We have 347 home health agencies that are have access, and currently have about 565 patients in the registry. As of this morning, 335 of those patients were updated, saying they need assistance, but there are another 230 that have not been updated since. They weren't updated Friday when the reports went out, and they haven't been updated since then. I can't stress enough the need for you to include the patient's weight in their in the registry. And also, there were 91 patients this morning in the registry who are missing a zip code. And the zip code plus the date of birth is what is so important in terms of the patient's unique identifier in order to keep HIPAA compliant, and that unique identifier for transporting those patients. Every Friday morning, as I've been saying, at 7 a.m., reports go out across Louisiana and Mississippi. Every parish, every county receives their individual report of who's on that list. It's really important that you identify these patients now. Don't wait until something's brewing in the Gulf before you say, "Oh, I need to put these patients on the at-risk registry." That's not the way this works. This is to this is to be a consistent a tool for consistent information about these patients well before we get into hurricane season, well before we get threatened with some sort of weather system. It doesn't it When the emergency managers, when they get these weekly reports, they have an idea of what they're going to be doing if there's an event over the next 7 days. If you start throwing in patients that were not being included in their plans, those patients are going to be brought to the back of the line. They're not going to be included. They were not included in the plans that were being developed throughout this entire hurricane season. And things are constantly evolving. So we need to identify these patients early and make sure that they're consistently updated each week in order for the emergency managers to actually include them in all of their plans. I know in some regions, especially in Louisiana, there are some regions that use nurses from the Office of Public Health to actually take the list and keep in contact with those patients throughout the hurricane season. That's a great system, but not every region does that. So we need your cooperation with regards to doing that weekly update. If you have an issue with emergency preparedness, if you have questions about emergency preparedness, after today's session, I will turn these slides into a PDF, and I will put them in the calendar invite. So you should see within an hour, if you go back to the calendar invite that you received that allowed you access into today's Zoom, you will see a PDF. And this slide, if you have an issue with regards to Louisiana Hospice or Mississippi Hospice or Louisiana Home Health or Mississippi Home Health, if you just click on this, it's going to give you an email that's going to send that information. It's going to appropriately route that question that you have for emergency preparedness. There are also other supports. There are links on our website that's at lmhpco.org for providers, as well as there's a section just for families, information, things that you can download and you can print to hand out to patients and families during the upcoming hurricane season. You can always, Crystal Birmingham is available, as well as myself, to assist you in terms of resolving any issues that come up for you, for your patients with regards to emergency preparedness and the at-risk registry. So I'm going to open it up to anyone can ask a question now in terms of what issues are you facing with regards to the registry. If it's about your login credentials, like I said earlier, give me a call, drop me a line, an email, and I'll be more than happy to set things up for you so that we can get you established with credible credentials that will get you into the system. Thank you, Ms. Marcotti. Office of Emergency Preparedness in St. Mary's Parish wants to remind everyone in Region 3 that St. Mary is a part of Region 3 in public health. Yes, the PDF that I'm going to send you is going to be printable, but if you simply open it up, everything that's hyperlinked will also be hyperlinked, so you can just click on the hyperlinks in order to get to those items that are listed. Any other questions? I want to thank you all for your time and your attention today. As I said, my contact information is available to you. We will be meeting again next Wednesday, the same time, 1 o'clock, to continue our discussion and prepare for this year's coming hurricane season. If you have no other questions, yes, in summary, not all patients go into the at-risk registry, just those we've identified as being who are living alone without a caregiver, or who have a caregiver who's either mentally or physically incapable of carrying through on an evacuation order, or they don't have the financial means to evacuate, or they're just plain stubborn, they're refusing to evacuate. One of those four reasons, or the only reasons for putting a patient into this registry. If there are no other questions, I want to thank you for the extra 5 minutes of today's session. And in the meantime, stay safe, and we'll see you next week. Thank you.